My next guest is going to break this down a little bit for me. Kyle Moran with Young Voices. Welcome to the James Show here. And, you know, the Tylenol is just the latest in the controversial topics that shouldn't be political but somehow are. We've had the long-going debate about vaccines and the vaccine schedule. We're just coming out of all the weird medical stuff that happened with COVID. So, Kyle, I think this Tylenol situation fits right into context with the larger debate we've been having for years.
Yeah, I thank you for having me on. And I have to admit, I did not see this one coming in terms of Tylenol, but it is definitely amusing seeing all these people. There are genuinely people out there now who are just taking Tylenol as a way of spiting the president, which is certainly a unique approach to this. But in all seriousness, RFK, HHS Secretary, and President Trump are at least trying to get to the bottom of what's been going on with this huge spike in autism diagnoses. I mean, the amount of diagnoses that we're having in this country is just astronomical. It's 1 in every 31 children now under the age of 8 is diagnosed with autism. So, I mean, something has clearly gone very wrong. My concern is that they are getting way too out in front of themselves before the evidence is really clear in terms of whether Tylenol really does cause this or not. And without saying that it doesn't, I don't think that's very wise to double down on some of what we're seeing from one side of the aisle. I also don't think it's very fact-based yet to suggest definitively that pregnant women should not take it either.
Right. So we're in this weird gray area, which I think we would be more comfortable if it wasn't political. If you had some doctors who were saying Tylenol is dangerous and some other doctors who were saying, no, as long as you don't go overboard, it's fine. You know, people wouldn't feel as emotional about this topic. We wouldn't have people taking handfuls of pregnant ladies taking handfuls of it and just bombing it on TikTok, if not to spite their political opponents. And that's one of the things that's so dangerous about intersecting the two is this other pre-existing emotional baggage that you bring into the argument really skews people's interpretation.
Oh, absolutely. And it gets to the heart of what you were talking about, the politicization of public health. A few decades ago, this was not a right-left issue, and for a brief period of time, it was more of a left-wing issue. RFK was considered pretty far left for a lot of standards.
He's
Obama
a Kennedy.
Yeah. Obama had even thought about bringing him in, but he was too controversial for the Obama administration. So there has been politicalization of this for quite some time. The RFK, his legacy on this has been very, very controversial, though, because he has for decades attempted to point out causal links between various different types of things with autism as well as all sorts of other diseases. Now, this comes at a moment in American politics where public health has, to your point, become more politicized. So people do not trust what officials are saying nearly as much. And we have seen these huge upticks in autism rates as well as other types of mental diseases. So it's really a crucial aspect that we have to get right. And so that's why I'm concerned that by making this proclamation that pregnant women just should not take Tylenol because it causes autism, this has only made it worse. I don't see how this is really going to help too much of anything. And it's unfortunate because I think that Trump is the first president in a long time to really want to get to the bottom of what's going on here.
Well, I think politics is just going to ruin any chance that we had at an honest debate on this because some people are just so calcified and some people think they're fighting literally Hitler. So, I mean, if you think the guy's Hitler, would you take his advice on Tylenol? I don't think so, Kyle.
That's a fair point. The thing is with Kennedy, I mean, he had made, obviously his background on this was the subject of many debates before he was confirmed. And he promised Congress in no uncertain terms that the quote that I used, or the phrase that I used for my article in the Washington Examiner is, if you like your vaccine, you can keep your vaccine. So basically he presented himself as sort of a vaccine skeptic who was not going to remove people's access from that. But by firing the entire CDC's board in terms of who recommends what vaccines, that impacts who qualifies and what vaccines qualify for healthcare coverage for millions of Americans. And I have to imagine that there are many Americans out there who are trying to avoid getting dragged into this politically, but who will remember on Election Day if these promises have just gone up in smoke. These vaccines, if they're starting to get paid out of pocket because insurers can now deny the claims, it can be quite expensive for a family.
All right, Kyle Moran from Young Voices. Where do the fine people find your work online?
Sure. So I am on X at Kyle P. Moran, and you can check my portfolio out at Young Voices website.